Hello everyone. February is Heart Month, so happy Heart Month. My name is Sandeep Nathan. I'm an interventional cardiologist and professor of medicine here at the University of Chicago Medicine, and I'm joined by my colleague, Dr. Johnson.
Hi, I'm Amber Johnson. I'm an assistant professor of medicine and a general cardiologist here at the University of Chicago.
So Amber, we're here today to talk a little bit about the symptoms of heart attacks in men versus women. And we know that there's certainly similarities, but there's also some important differences. Can you touch upon some of that?
Sure. So most people know that the main presenting symptom with a heart attack is chest pain, but some people don't realize what that can mean or how that might feel. Women tend to have some symptoms that might differ a little from what men experience. Again, chest pain is important, but sometimes women might present with other symptoms like shortness of breath or dizziness. And there's been some suggestion that the level of pain that women experience can sometimes be ignored because it may not seem as severe as what one might think a heart attack might feel like.
I'm going to pick up on a couple of topics that you just raised. The point about being ignored, it's sort of dismissed sometimes by the patient as well as by medical professionals,
Right.
Simply because it doesn't conform to the same level of expected severity or the types of symptoms that you might see in a man. So I think for patients, it's really important for them to sort of take honest stock of what they're feeling and say, is this normal for me? Is this something that's concerning for me? Is this, getting worse, and certainly seek medical attention.
Definitely. And something I often tell my patients is to think about what brings the symptoms on. A lot of times when you are exerting yourself, when you are climbing stairs, doing housework, exercising, if those symptoms come about, it may be because of blocked coronary arteries or ischemia.
That's a great point, and we think about heart attacks as this big standalone event, but frequently there are some warning signs that lead up to a heart attack, and so I think for both men and women, it's important to really be honest about that and say that this is something progressive and may lead to something far worse.
Right.